We may choose at the end of our extensive examination to perform additional manipulations based on the clinical signs detected in the initial examination. This horse showed a grade 5 out of 8 right forelimb lameness. There was mild atrophy of the long head of triceps and the pectoral muscles on the right side. There were resting muscle fasciculations of the right pectoral muscles. Flexion of the neck induced fasciculation of the right triceps muscle. When the right forelimb was extended forwards or protracted, the horse physically fell forwards. Retraction of the right forelimb was resisted. This pattern of muscle atrophy is very unusual for disuse atrophy and is therefore more likely to reflect neurogenic atrophy. Both muscles were innervated by the 7th and 8th cervical nerve roots, and we speculated that there was potentially a component of neuropathic pain, given the muscle fasciculation that was observed and the profound reaction to protraction of the right forelimb. The horse's baseline lameness was improved to some extent by intra-articular anaesthesia of the scapulohumeral joint, becoming only grade 2 out of 8. And there was both scintigraphic evidence of increased radiopharmaceutical uptake in the distal aspect of the scapula, and also a small osseous cyst-like lesion detected radiographically. But we've considered it quite likely that we had more than one source of pain contributing to this horse's clinical signs. Bear in mind when you're inspecting the horse to be aware of scars or white hairs suggestive of previous surgery or bandage injuries, given that the bandages may have been applied because of some previous surgical intervention. So in the horse on the left, we can see a longitudinal scar on the ventral aspect of the neck. This was associated with previous surgery, placement of a basket to fuse the 6th and 7th cervical vertebrae. The horse in the middle has white hairs on the plantar aspect of the distal crus, the result of bandaging following surgery to treat proximal suspensory desmopathy at a different clinic. And the horse on the right, we can see white hairs and surgical scars at the incision site for performance of neurectomy of the deep branch of the lateral plantar nerve and plantar fasciotomy. Be aware that these scars and white hairs may not be visible in a horse with its hair coat on. So my take-home messages are: be a detective, inspect and palpate in a systematic way, have knowledge of anatomy, and also know where to find more information. Be aware that often in a lame horse there may be no localizing clinical signs, and that some swellings may be misleading. Consider the horse as a whole, and always ask, why is what is happening actually happening? For example, why is this horse on the right standing with the heels of both hind limbs slightly elevated?